I'm pleased to be talking with Dr. Samantha Ross today, an assistant professor at West Virginia University in the United States. Dr. Ross and her colleagues recently published a paper in the Journal of Physical Activity and Health using 2017 to 2018 National Health and Nutrition Examination Survey data, or NHANES as it's often called, comparing meeting 24-hour movement recommendations among those with and without functional disabilities. And I wanted to ask Dr. Ross just a few questions. So how was functional disability defined, and what was the prevalence that you found in the US?
Great, thanks for having me here today. We defined functional disability using broad categories based on the standardized disability question set, which has been standardized across national data sets to help us consistently identify people with disabilities based on function. So there are 6 questions that ask, do you have serious difficulty with hearing, seeing even when wearing glasses, concentrating, remembering, or making decisions, walking or climbing stairs, and or bathing or dressing. And we grouped those together and for short, identified individuals as experiencing impairments in functional domains of hearing, vision, cognition, mobility, or self-care. Based on our estimates, approximately 20.7% of adults 18 to 65 years old experience one or more disabilities in those functional categories.
Wow. And then how was meeting guidelines defined?
Great, so we used the newly released Canadian guidelines for 24-hour movement behaviors that were published in 2020. And the uniqueness about these guidelines is that they present physical activity, sedentary behavior, and sitting as activities we should be looking at in combination. So we defined physical activity as achieving 150 or more minutes of physical activity per week, meeting sleep guidelines if you slept on average 7 to 9 hours per night, and sedentary behavior was defined as sitting for less than 8 hours a day on average. And we were interested in if adults with functional disabilities met each of those guidelines, and also if they were meeting those guidelines in combination.
And were each of those components self-reported?
Yes. So NHANES is a self-reported national survey.
Okay. So then what were your major findings?
We found, and with what's consistent with the literature, is that adults with functional disabilities, specifically relating to mobility, cognition, and self-care, had approximately half the odds of meeting all 3 of those guidelines compared to adults with without disabilities. So there seems to be an impact when we look at these behaviors in combination, sleep, sedentary, and physical activity, that if you're not meeting one, you're likely to not be meeting the others. So that combination seems to be important. And specifically for adults with functional disabilities in the domain of mobility, we saw a very low prevalence or low number of adults meeting the sleep guidelines and the physical activity. So there's something about that combination of sleep and physical activity that seems to be impacting or be differently experienced by those with mobility impairments.
So is there a takeaway you'd like to share from your work?
This work highlights the gap or the disparity in physical activity, sleep, and sedentary behaviors for adults with functional disabilities. And it also highlights the value of exploring these behaviors in combination and how doing so helps us identify pockets of groups that we may target these behaviors jointly in our interventions. So sleep and physical activity may be something we can work towards together among those with mobility impairment, and that may ultimately help us enhance health behavior and health outcome within this group.
Yes, very important. Thank you so much for sharing this information with our audience today.
Thank you for having me.